Am I audible, sir?
Yes, madam, you are audible.
A very good morning to one and all. Myself, Dr. Shiddanagouda, first year PG scholar from the Department of KAYACHIKITSA, with the blessings of holiness of Sri Manipura Guru Mahanta Swamiji, on behalf of Department of PG Studies KAYACHIKITSA, are organizing KAYACHINTANA 2021 National Webinar Series 4. I welcome you all. Now I request Dr. Praveen Sajjan sir, Assistant Professor, Department of KAYACHIKITSA, to give welcome speech. Over to you, sir.
Thank you. Well, good morning to all. Today I am very happy that we are conducting national webinar, fourth, that to the second session. Today, Shiddanagouda sir is dealing with the Madatyaya. It is very interesting subject, and it is most prevalent in the poor class people, and where withdrawal of the alcohol is very difficult. And we are eager to hear you from sir. Today I will welcome Shiddanagouda wholeheartedly. I welcome to the Shiddanagouda sir for today's session, and I welcome the principal and management who supports the in the events for the successful completions, and wholeheartedly I welcome HOD and other teaching staffs of my department, and wholeheartedly welcome PG students, UG students, and the today's attendees. Thank you. Over to you.
Thank you, sir. Now I request Dr. Tushar, first year PG scholar, Department of KAYACHIKITSA, to introduce our guest. Over to you, Tushar.
Is pursuing his PhD from Parul Institute of Ayurveda, Gujarat. Sir has been highest scorer in Ashtanga Vidya in first BMS. Sir has been awarded as Rasa Visharada in year 2000. Sir has been Sir presently working as Department KAYACHIKITSA at Sindagi Santvireshwar Ayurvedic Medical College Hospital, Haveri. Thank you, sir. Over to you, Dr. Nath.
Thank you, Dr. Tushar. for the introduction. Now I welcome sir and requesting you to continue the session, sir. Over to you, sir.
Hello, am I audible, madam?
Yes, sir.
A warm good morning to everyone gathered in this online platform. I am happy to be part of this national level webinar series KAYACHINTANA 2021 organized by PG Department of Shri Vijay Mahantesh Ayurvedic Medical College, Post Graduation Studies and Research Center ILKAL. I seek the blessings of Shri Mahanta Guru Swamiji and my Guru Dr. G. Srinivas Acharya sir. At the outset, I am thankful to the organizers of this KAYACHINTANA 2021, Dr. P.V. Joshi sir, Dr. Edward Navar sir, Dr. Venkatesh Pallampalli sir, and Dr. Praveen Sajaran sir, and the esteemed Institute Principal Dr. K.S. Das sir. With due respect to all these people, I am continuing with my presentation. My screen is visible, madam.
Yes, sir.
Hello, screen is visible.
Yes, sir.
Okay. Okay, once again, I welcome all the student friends and practitioners and all the faculty members of Vijay Manteshwar Medical College and Hospital, ILKAL. At present, we come across most of the disorders. Among that, some of the substance abuse disorders are comes to be the hectic to the family as well as even to the society. This is the burden of the present situation. Present we are in a situation of the COVID-19. I think all of you know the regarding the ban of the alcohol and even the closed of the alcohol wine shops during the last COVID-19 situation. Most of the individuals who are had a habit of the consumption regarding the alcohol, they are sometimes commit the suicidal attempts, and sometimes they even addicted to such a thing. The alcohol contains like the spirits and all, and even they had a history of their consumption of the sanitizers. That was the history which is found during last the COVID situation. That much people are addicted. That's why myself consider this is time to discuss about such a wonderful disorder which is even dealt in the Ayurveda, and we can practice very elaborately from Ayurvedic perspective, and we become and we can shine like anything by doing the few of the addictions at present. Okay, that's why we come to the presentations of the clinical perspective of the Madatyaya. Before starting this topic, just refresh our knowledge from the text. It may be from the different the Brihatrais as well as the Lagutrais, and earlier the knowledge from the different the textbook of the Ayurveda. Few of the questions just I'm going to ask to the students just to interact with the students. If anybody knows the answer directly, you can answer or put your answer in the chat box. The first question is Madhyam dash Janananam. At the end of the session, we'll assess who is the powerful person and who is having the good Meda and the Smriti by answering these questions. The second will be Madhyakshobo dash Haranam. The third question is Madhya is having the opposite quality which is opposite to dash. Medo Vahini Dushanti dash Chati Sevanats. The next question will be the Bahudravyam, Bahugunam, Bahukarma dash. Next question. Sarva Madhya Vikaranutis dash. Anybody? Raise hands. Okay, we'll take later, no problem. Next, this is the present today's topic, clinical approach to the Madatyaya. Myself, Dr. Shiddanagouda KB, working as the associate professor in the Department of KAYACHIKITSA at Sindhigi Shantavireshwar Ayurvedic Medical College and Hospital, Haveri. Whenever we go with the different disorders, it may be from the Ayurvedic perspective or even from the contemporary medicines, we should know some of the things very essentially. The first and the foremost regarding that will be the terminologies which are related to that particular the disorders. First, in case of the alcohol use disorders or alcohol abuse disorders, we have the few of the terminologies which are even explained in the Ayurveda from the Brahatrais. Whenever you go through the Sushruta's reference regarding the contraindication about the Rasayana, the person who are unfit for the Rasayana consumption, there he used the word the Vesani. The Vesani is nothing but the person who are addicted to a particular the substance or even the activity. And few of the words which are even explained in the some of the context while explaining the arha as well as the anarha concept. It may be from the Svedana Adhyaya Vidhi and even the Sveda Vidya Adhyaya. There you use the word Madhya Nitya, Madhya Vikara, Madhya Pita. Okay, these are the individuals in which they are addicted to the particular the substance. Okay, in modern parlance or the textbook from the psychiatry, they deals with the substance use disorder or alcohol use disorder under the different the terminology. Not only this, even the many of the substance abuse disorders are existing at present, but most commonly the use drug as well as the psychoactive substance will be the alcohol because of the easy availability and many of the reasons the person go on consuming the alcohol. And the psychiatry textbook, and then we deal with some of the terminologies. That is, first one will be the drug abuse. Here drug abuse is also known as the substance abuse. It is nothing but the use of the alcohol or the substance in amount or methods which are harmful to the individuals or the others. It may be for the individual purpose or even to harm others also. Next, the addiction in terms of the fact of the condition or being addicted to the particular the substance, that is also or activity, that is called the addiction. The next, whenever person consumes the few the substances, particularly there is a chance of the intoxication, what we consider the mada. It is considered the transient condition following the administration of any of the psychoactive substances, that is called as the intoxication. After consumption of a few of the drugs, sometimes the individual may forcefully withdrawn from those drugs and even by their family members or even himself is uh, ready to quit the drug. If those drugs are withdrawn, the status which is experienced in the individuals by partial as well as the total withdrawal of the drug, that is called as the withdrawal state of that particular drug. It may be alcohol, it may be cigarette or the tobacco. Some of the clinical presentations which are experienced by the individuals. The next, whenever you go with the Ayurvedic classical reference regarding the Madhya. Madhya is considered to be a broad heading. Okay, under the heading of the Madhya, we have the different the preparations which are explained for the therapeutic purpose as well as even the which is used for even for the person who used even for the untherapeutic purpose also. Okay, madhya is having the difference, the antique, the man which is using the madhya, and even it is the part of social as well as the cultural life. Okay, the next, the madhya is having the nectar like properties, what we consider the amrita if it is used in the judicial manner. Otherwise it even acts as the poison. Madhya, it even causes by ingestion it causes the amada. Okay, we will have the different the concept of the amada. Okay, after consumption of the different the drugs, we have the different explanation pertaining to that in the Sutrasthana also, while explaining the Mada Murcha Sannyasa and even in the Madatyaya Chikitsa also. Here Mada refers to the state of intoxicating or in exhilarating condition. The next, whenever you see the classical reference regarding the explanation about the Madhya, there is an explanation about the Madhya Guna. There are different gunas which are explained in the text. Madhya is Lagu, Ushna, Tikshna, Vyavaya, Ashuga, and Ruksha, Vikashi, Vishada. These are the different the gunas which are explained in the classics. He told, Charaka says Madhya is the one. What is the rationality behind explaining this Madatyaya chapter immediately after the Vishachikitsa. The Chakrapan has clearly identified the reason regarding that. The Madhya is the one which is having the similar guna, Visha Sadrusha Gunam. It is having the similar qualities as that of the Visha and Moha, the Moha Sanjananath, and it produces the sum of the presentations, particularly Moha, which is similar to that of the Visha. That's why immediately after Visha Chikitsa, I explained the Madatyaya Chikitsa. Next, according to there are different methodologies which are explained in the text. The person how to take the amadhya and how much amount of the amadhya one should take for their therapeutic purpose. And based on the dosha involvement, the person even can take the amadhya based on the particular the dosha. If vata is involved, better to go with the madhya which is prepared of vatikebhyo hitam madhyam prayo gaudika paustikam. The madhya which is prepared out of the Guda Vikruti, that has to be taken. Next, in case of the involvement of the Kappa Pitta Adikebhyastu Mardvikam Madhavam Chat. In case of the Kapha as well as the Pitta involvement or the Pitta individuals, better to go with the Mrudvika, that is nothing but the Madhya which is prepared with the Adraksha and the Madhu, that is beneficial for them. After explaining this in text, we have the different the good things. Okay, that is what already told. The madhya is considered to be an amrita if it is used in a therapeutic manner, and whatever the explanations which are given, the vidhis, different vidhi which is followed for the madhya sevana. Here it told bahudravyam, bahugunam, bahukarma madatmakam. The person prepare the madhya by different the bahudravya by using their different the drugs or ingredients. It is having the bahuguna, the multiple the qualities, and it can be used for the different therapeutic purpose. Next he says gunair doshascha tan ubayam cha upalakshita. Next, finally he says vidina matraya kale hitair annam yatabalam. Everyone should consider before the prescription of the madhya as the therapeutic dosage in some of the disease condition. Always use the madhya in a proper vidhi. There is a specific vidhi which is explained by the charaka regarding the madhya, okay, but that has to be followed, and the proper the quantity, and in which rutu or the kala which madhya is essential, and hita anna, and even the bala, rogi bala as well as vyadhi bala. Considering that one should consume the madhya, then it acts as it told, that is prarustoyaha piben madhyam tasya ad amrutam meta. Then only it acts as the amruta. Otherwise, it acts as the visha itself, and it produces the many of the disease condition also. Not only this, the one more explanation told the yuktya pitam karotashu madhyam sukam madapradam. If madhya is not taken according to your need or the permutation as well as combination, okay, then it acts as the avisha. If it is properly consumed with the different ahara or in the form of the aushada or based on the prakriti, then it gives the very good the desired effect in individuals. Next he told not only this, madhya will do the rochanam, deepanam mrudyam, swara varna prasadanam, Prenanam Brahmanam Balyam Bayashoka Shramapaham. From the earlier reference in the Sutrasthana, while explaining the Madhya Varga in the Annapana Vidyadhyaya, there he told about again the Madhya is the one which is beneficial in most of the disorders. Here also he told the Madhya which is having the Rochana, that is in terms of acts as a good appetizer, and even it do the Agni Deepana, and even do the Rudya, because all of you know that the madhya is considered to be an amla pradana. Okay, it is amla pradana, the rasa which is having, and it mainly considered to be a best for the rudya. Not only this, the person if you have the madhya in a judicial manner, and even it acts as the swara varna prasadana also, and even it gives the strength to the individuals, and naturally it relieves the stress as well as the phobia, and even the grief, and even the exertion. All of you know the most of the person, usually they are working prolonged in a field, they are having the habit of their consumption. If you ask some of their patients, they dominantly tell usually I used to take the madhya during night hours because of their continuous the working, that too in the field, that too just to relieve the shrama in them. That is most commonly seen most of the patients, they are only taking the madhya for the shrama hara action. Okay, in Sutrasthana also he told about the Sura Shrama Haranam. Like that also explanation you are getting. It's purely based on your the need. If you are using that Madhya, then only it acts as the Aushadha. Otherwise, always it acts as the Visha. From the contemporary medicine, if you consider the alcohol, okay, almost all the alcohol beverages we can consider under the heading of the Madhya itself. Here it told about the here alcohol refers to the chemical name ethanol. Most of the time the alcohol refers to the ethanol. The alcohol is considered to be the psychoactive substance or the drug, and it is always having the CNS depressant activity. It acts as the inebriant poison. Alcohol is considered to be a main ingredient in few of their preparations, mainly the beer, wine, distilled spirits, that is hard liquor, and alcohol is one among the most common the psychiatric disorder at present because of its the prevalence. The next, the prevalence. If you go with the prevalence rate of the alcohol, okay, alcohol is not only restricted to the male as well as female gender. Okay, it is consumed by the both the genders. If you go with the prevalence rate, around 23 to 74% of the males are consuming the alcohol. Among that, the females 24 to 48%. If you see the global prevalence rate, around 380 million people are alcoholics worldwide, and whatever the deaths which are occurring globally, around 5%, 9% of the death is mainly because of the alcohol consumption. And whatever the disability which is happening at present, it may be in terms of the injuries, that is mainly because of the alcohol. That covers around 5.1% of the disability adjusted to the life year, that is mainly alcoholism. If you see the WHO, the World Health Organization, related to the alcohol and health, around every year 3 million people 3 million people is mainly dying because of the alcohol. Whenever person using the alcohol, you need to identify, sometimes the alcohol causes the harmful effect or the ill effect on the body. It may be because of the continuous usage, not proper following the dose, and even the food consumption and all, then harmful, that causes the harmful effects on the body. If you see that around 48% of the people are suffering by mainly the cirrhosis of the liver, and 26% are by mouth cancers, 26% again by the pancreatitis, 20% of people are by tuberculosis, 11% of individuals are suffering with the colorectal cancer, and 5% of breast cancer, and 7% of the hypertension and heart disorders. Okay, if you want to do anything in the field of the alcohol or to reduce the alcohol consumption, the WHO advises always reduce the harmful use of the alcohol just by regulating the alcohol distribution and restrict. Okay, giving the alcohol to the individuals, always restrict, don't give how much amount they want always. Okay, at least try to restrict the quantity of the alcohol giving from the wine shops, and even ban the advertise, giving the advertise regarding the alcohol preparation. Better to ban those and increase the price. By that we can even reduce the 10% of the harmful use of alcohol at least by 2025. If you go with the classical reference, that too from the Sharangadhara Samhita Prathama Kanda 4th chapter, here he told about what is the exact understanding about the Madakari. Okay, he told Buddhim Lumpati Yadravyam Madakari Taduchyate Tamaguno Pradhanam cha Etya Madhya Suradikam. Because of the presence of the Tamoguna in the drugs, particularly the sura, and the sura, the person, the having the loss of the function, particularly buddhi, the intellectual, the loss of the function of the individuals, that is called as the Madakari. This is the very good explanation which is given by the Sharangadhara. What is the exact understanding about the Madakari drugs? Next, effect of madhya. If person takes the madhya, okay, there is a chances of the adverse effect of the body. That is also documented in the Ayurveda. What we discussed, the alcohol, the excessive usage even affects the different systemic illnesses. Here also Charaka has documented that रसवातादिमार्गाणां सत्वबुद्धि इन्द्रियात्मानां प्रधानस्य ओजसश्चैव हृदयं स्थानमुच्यते. The hridaya comes to be the sthana for the ojas. A person takes the madhya, that too particularly the tikshna ushna madhya prolonged time, that even affect the sattva and the buddhi, because this is the adhisthana for the sattva. Okay, and the pradhanasya ojasa, the pradhana ojas which is present in the body, which is maintaining for and even the madhya which is having the opposite guna as that of the ojas. And atipitena madhyena, a person, that is already told, the person go on consuming the atimatra madhya sevana, then only it affects the ojas hridayam, and it produces the vikruti pertaining to the hridaya and dhatus which are present in the hridaya. Next, now, whatever the explanation we have in the contemporary medicine pertaining to the effect of the alcohol. If person take the alcohol, there is a hampering of the functions of the brain. Okay, that already discussed under the heading of the Madakari, Buddhim Lumpati Edravyam. It causes the altered the conscious state of the individuals and altered perception in individuals, and there is a problem pertaining to the mood. It may be a state of based on the quantity which is consumed by the individuals. The person will have the problem pertaining to the mood and even the behavior of the individuals. That is always seen in the state of the intoxication, that is dealt under the heading of the Trivida Mada, Pratama Mada, Dvitiya Mada and Tritiya Mada. That is also already documented in the Madatyaya Chikitsa. We will see in next slides regarding that. Next, the Madatyaya, the real topic pertaining to the today's the presentation. All of you know that the Madhya is the cause here. That is the disease produced by the improper. Always try to remember this. If you are using Madhya for a single day, it doesn't cause any disease. If it is taken improperly and for a prolonged time without considering the Vaya, Bala, Kala, Prakriti, then only it acts as the Visha and it causes the disorder called Madatyaya. Madatyaya is produced when person consumes the excessive amount of Madhya without considering the Prakriti, Satma and the Agni. Okay, there are different factors, not only this. Okay, Taraka even documented the Shat Trikas to consider about the Madhya. Okay, how to consume the Madhya based on the Shat Trikas. We'll discuss later about those. The definition of the alcoholism, a chronic disorder characterized by uncontrolled drinking and preoccupation with alcohol. And even alcoholism is the inability to control drinking due to both physical and emotional dependence on alcohol. If you see this image, easily we can find out how much the person is addicted. He is over that alcohol glass itself. That much the persons are addicted to the drugs nowadays. There are different reasons for that. Okay. Next, if you go with the Madatyaya Chikitsa Adhyaya, there are different lakshanas which are seen in the individuals who comes to us regarding the consumption of the Madhya. They will present with their different the systemic presentations. If you see initially, Charjya Atisara Ullasaha, the dominantly a presentations of the Chardi, Atisara and the Rullasa, the Sammoha, that is the altered, the perception or the sensorium. Rudaya Veta, the person will have the discomfort in the precardial region. Most of the time, the palpitation they will have. They even have the aruchi, the loss of the appetite, and they are unable to take even the food substances. Pratata Trushna, the continuous, they will have the continuous, the Trushna and the Jwara. Vepana, that is what we consider the Eka Dosha Kampa or the tremors, the Shrama, the early exertion, and Prajagara. The most of the time, the person will have the lack of the sleep. Whenever he take the drug, then only they will have the proper sleep. Sharira Kampa. Next, some of the neuropsychiatric presentation in terms of the Brahma, Pralapa, Rupanam, Asamhatam Chaivacha, Darshanam. That is nothing but the person most commonly present with these symptomatology, either in the form Shirashula, Arati, Chardi, Daruchi, and even the Udarashula, the Rudayavata, Kampa, and even the problem pertaining to the mood, and even the Smriti Hani, and the Rupanamta Darshanam, Rupanam Asatana Chaiva Darshanam. Normally, the most of the individual presents with either the visual as well as auditory hallucinations that comes under this asatamcha rupanam darshanam, lack of social perception in relation, the lack of the relationship. If you go with these earlier, the clinical pictures, if you want to analyze the things in a systemic manner, the alcohol mainly affects the not only a single system, the multi-systemic effect it causes. If you go with this, the mainly involvement of the brain dysfunction, the involvement of the musculoskeletal system, the involvement of the neurological system and the peripheral, the nerves, and involvement of the hepatobiliary system, and even the gastrointestinal system and cardiovascular system, and even the total from throat to the till the rectum, almost all the system which is in which covers the patient had a history of the chronic consumption of the alcohol. The clinical evaluation, okay, all of you know that whenever a patient comes to the OPD, this is a very essential part one should know. First, if you thorough with the theoretical knowledge, then it is very easy to evaluate the case from the clinical purpose. First, the Charaka says, Rogamadav Pariksheta Tato Anantaram Aushadam Tataha Karma Bishak Paschat Jnana Purvam Samopachari. That is nothing but initially one should go with the thorough examination about the patient from the Trivida Pariksha, Darshana, Sparshana, Prashanaiha Pariksheta. From that part, just analyze the things and try to diagnose the patient, then it is very useful for the karma. Tataha karmeti chikitsam. After that, easily we can give the desired effect to the patient and easily we can treat the patient without much of discomfort by giving the different and even applying the chikitsa principles. Here he told, Purvamiti, Jnana Purvamiti, Karma Darshana Janita Jnana Purvam. Always try to evaluate the case under the heading of Trivida Pariksha, Darshana, Sparshana, Prashana. If you do these things properly, then it is very easy to analyze the dosha and diagnose the disease, and directly we can go with the samprapti vigatana in individuals. Next, just whenever patient comes to you with the history of the alcoholism, try to identify the main complaint which is causing the more of discomfort to the patient. That has to be considered first. Most of the patients who are comes in a state of the acute intoxication, or the patient who had a history of the chronic alcoholism, they will also come to you. Try to analyze the each and every complaint of the patient and even the associated complaint of the patient. Most commonly observed the presentation in terms of the history, the patient will have the history of the nausea, vomiting, abdominal pain, and even the chronic cases will have the yellowish discoloration of the sclera, and even some patients will have the generalized body ache, the tremors, headache. These are most commonly the identified symptoms. Along with this, if any other symptoms also present, try to identify them. Next comes the family history. This is also very important component of the diagnosis. Most of the time, the familial tendency of the consumption of the alcohol. If father is or mother is consuming the alcohol, most of the children are mimics. Always they try to follow the parents. They are if mother or father having the history of alcohol, there is a chances or a familial the tendency of those the substance abuse disorders are also possible in condition. And even the person who had a history of the loss of their loved ones, there are different reasons for the alcohol consumption. Try to identify if there such any identifiable or the history which is peculiar and made the patient to consume the alcohol. The most commonly the loss of their loved ones, or sometimes the loss of their business, and sometimes the social factor, and even because of the some other factors the person will have the consumption of the alcohol. Next comes the personal history. The personal history today we consider mainly on the alcohol. If person had a history of the alcohol, better to know about what is the duration. Some patient only have the history of the alcoholism for the few months. Some patient will have the history of the alcohol for the few years. Okay, that's why to know about the extent of the damage and involvement of the multiple system in a cases who suffers with the alcohol, the duration is very, very important. Okay, there are two presentation which is most commonly seen. The most commonly patients will have the minimum history of the alcoholism. It may be in a few days or the few months, and some patients even possibly with the chronic consumption of the alcoholism years together. Next comes the quantity. Okay, how much the quantity the patient is consuming the alcohol. That is also very, very important. Why the quantity is important means to know about the concentration of the alcohol in the body, and even to know about the extent of the damage to the particular system. The quantity is important. Next one will be the brand. Okay, no need to hesitate about asking these questions, because if you want to plan the correct treatment, you need all these: the duration, quantity, and brand. Some patient will have the history of their consumption of the beer. Some patient will have the history of their consumption of the whiskey, and some patient even have the raw alcohol itself. To know about the percentage of the alcohol, the brand of that particular the individual is very important. The person who is consuming the alcohol, particularly a beer, that is not having the much of the alcohol percentage, it's around 7 to 8%. A person consuming the raw alcohol, that is around 30 to 40% the alcohol which is present in that particular brand. That's why the brand of that particular the drug is important. Next, the adverse effect. Most of the individuals, they already taken the few of the treatment for that drug de-addiction, and it has caused the adverse effect on them. Try to evaluate that. Sometimes the patient who are having the chronic history of the alcohol consumption, there is a possibility of the hepatitis in the earlier days, or the possibility of the even the presentations of the kamala in them. That's why try to evaluate that and try to collect the information regarding that adverse effect on the body. It may be over the musculoskeletal system, or it may be a gastrointestinal system, or it may be over the hepatobiliary system. Okay, which is affected in them. Try to evaluate that, and is there any earlier hospitalization regarding that particular drug consumption, and take the details of that treatment, and even the API reports are available with them. Try to collect the reports of that and take a photos of that for your the documentation. Okay, what usually I do, if patient comes with such a peculiar history in my practice, the documentation is the first thing before starting any of their treatment. If you diagnose the case, always maintain the documents before and after the treatment in your cell phone. You can maintain the reports. It is very easy to convince about the evidence based medicine. Next, after the history, next comes the examination of the patient. In case of the examination, we need to go with the general examination. Just go with the examination of the patient from head to toe, what we consider the general examination. Among this, try to evaluate the pallor, icterus, cyanosis, clubbing, edema, and lymphadenopathy. Most of the cases who comes to us, okay, in general examination, usually try to identify the gait of the patient. The patient who had history of the consumption of the alcohol, usually they will have the drunken or the gait. The specific gait which is seen in them will be the drunken gait or the alcoholic gait. And the person who had the chronic history of the alcoholism, the chances of the icterus in them, the yellowish discoloration of the sclera, as well as the mucous membrane, what we consider in the form of the Pita Varnata in the Netra and the Twak. And next will be in terms of the systemic examination in them. Try to evaluate first the central nervous system examination, particularly the orientation to the time, place, person under the heading of the higher mental function. Just try to ask the question to the patient. He is semicon. Sometimes in acute intoxication cases, it's very difficult. The patient is partially oriented. That time we need the help of the patient attender or the relative. Just try with your orientation just by asking the patient name, place, as well as the time. If disoriented, okay, we can easily identify that, and even to know about the concentration of the alcohol, how much amount he may be consumed by the altered the sensorium. Next, the chances, the involvement of the gastrointestinal system is the most common in most of the cases. Just go with the per abdominal examination just by the palpatory method. most of the time the patient who had a history of the alcohol consumption, initially they will present with the Kamala. If it is not treated successfully, or sometimes patient themselves refuses their treatment and go on consuming their drug, that times the Kamala may land up in the other presentations also. That is in terms of the Kumbha Kamala, or the person even may land up in the Akrutodara. To know about the organomegaly in them, better to go with the GI examination, and even to check about the presence of the tenderness in the involved site. Most of the cases will have the tenderness in the right hypochondric region in a the hepatitis phase. Next comes the investigation. Okay, some of the investigations which are most commonly carried out in the alcoholic patients, particularly the complete the blood count, and even the erythrocyte sedimentation rate, RBS, and blood alcohol concentration. Okay, just to rule out about the other systemic pathology, just go with the complete blood count, and even to rule out the infective pathology, the erythrocyte sedimentation rate, and some of the individuals, even the involvement of the other systemic pathology, or be the random blood sugar level. In this, usually in my case, I usually go with the LFT. Okay, LFT, that is liver function test. Most of the cases who is having the chronic history of the alcoholism, there is a dearrangement of the functioning of the liver function, particularly the rise of the bilirubin, and even the functions, the SGOT as well as the SGPT, and even the acute, some of the cases the binge drinkers. A patient is having the history of their consumption of the alcohol, the 5 or more than 5 drinks per day, then it is considered to be a binge drink. They will maybe land up in the pancreatitis, the acute or the chronic pancreatitis. To rule about the pancreatic enzyme and activity, better to go with the serum amylase test. Next, to know about the USG abdomen among the radiological investigation, USG abdomen and pelvis is mainly to know about the organomegaly, particularly a splenomegaly, as well as the hepatomegaly in a cases who suffers with the chronic alcoholism. Next comes the most important factor whenever we are dealing with the alcohol, the cage questionnaire. Alcoholism, this is mainly used for the chronic alcohol screening, that is called a cage questionnaire. Here see, just ask the patient after taking the history and the examination already you diagnosed, or sometimes whenever while taking history itself, just ask the patient, have you ever thought of cutting down your alcohol? Most of the patient says either no or yes. Then, have you ever become annoyed by criticize of your drinking? Have you ever felt guilt about your the drinking? Okay, most of the patients themselves feel guilt. It may be because of the social, cultural, or even by the family members. They are cursed. Okay, or even most of the time they will get the beatings also. Just ask the patient, have you ever felt a guilt about the consumption of the alcohol? And one more, the very important, the persons, they are having the history of the eye opener drinking. That eye opener drinking refers to the immediately after getting up from their bed, patients start taking the alcohol. Is there any such history which is existing in a patient? That is also very important. Okay, already try to implement just by the cage in terms of cutting down annoying and guilt just by eye opener history. Next, a patient comes to you. Okay, if you diagnose the case of the alcoholism with the different the stages, the first aid, what we can do in our clinical level, and in our we can implement this in your practice also. Just patient, keep him awake, don't let him, keep him in a recovery position, don't let him in straight, and give a plenty of the water to him, don't give the coffee to him, and keep him sitting up position, don't walk him around, just warm him, don't keep him under cold shower. Next, in terms of stay with him and monitor his symptoms, the most commonly better to monitor about the vitals, particularly the blood pressure, the respiratory rate, and even the the pulse of the individuals. Next, don't let him drink. Never give again the one more the drink of alcohol to him. Again, there is a chance of the worsening of their condition. This is a most commonly seen. If the same friend who had a history of the alcohol consumption and de-addiction is done, if he saw him in this state, again they will go on enjoying the alcohol party. That's why try to avoid from such party and drink in them. Next, the contemporary medicine says the list of the treatment protocol for the alcoholism. Just try to avoid alcohol, what we consider the nidana parivarjana. Just try to avoid the consumption of the alcohol. Just give the consolation to the patient. It may be by explaining the different adverse effect of the alcohol on the body, just by doing the group counseling or the individual counseling, and meditation, the yoga, and IV fluids, the vitamins, and even the aversion therapy. The most commonly used drug will be the disulfiram. And based on the particular presentation, if patient is having the insomnia and all, better to go with the short acting the sedatives. And next, the patient, sometimes the alcoholism individuals, there is a chance of the presentations of the mood disorder. That time it may be in terms of their depression is most commonly seen. Better to go with the antidepressant drugs, particularly selective serotonin reuptake inhibitors. Next, the antipsychotics. Sometimes the patient will have the antisocial behavior, like beating of the family members, and even the throwing of the objects, and unnecessarily the patient is having the aggressive behaviors. That time better to manage their cases with haloperidol, the antipsychotics, risperidone, and the olanzapine. These all drugs should be prescribed in the medical supervision and even by the psychiatrist in the IPD basis. Okay, these are the different treatment protocol for the alcoholism. The most common used drug will be the disulfiram, 250 to 500 mg in a divided dose. If you see these drugs, whatever the contemporary medicines, they are having the aversion therapy drugs. Try to analyze these. It is having, rather than it's the good effect, it is having the most of the time the adverse effect on the body. Most of the drugs are having the tendency cause the abdominal discomfort, like the nausea, abdominal pain, and headache, giddiness, and all. We can better manage by the Ayurveda medications from those patients. The complications pertaining to the alcohol abuse disorders, I already told, the alcohol is the one which almost affects the multiple the system. See, the neurological system, particularly it causes the peripheral, the neuropathy, and even gastrointestinal system. The particularly patient who had the history of alcohol, they will present with the gastroenteritis and the nutritional deficiency, cardiomyopathy, musculoskeletal problems, reproductive, the psychiatric problems, particularly the depression and Wernicke's encephalopathy or Wernicke's Korsakoff psychosis, and even the social problems, particularly the accident, divorce, and all. Next, the stages of the Amadhya. I am not going to discuss much about the stages of the Amadhya. Just the contemporary medicine has given the different explanation pertaining to the different stages of the intoxication. The same thing even documented in the Ayurveda under the heading of Pratama. Pratamo Madhyamo Annesya Lakshanestan Prachakshmahe. The Pratama Mada, Madhyama Mada, and the Tritiya Mada. These are the different stages which are documented in the Brahatrais. The first he told about Praharshanam Preetikaraha. The person will be in the state of the excitement in an initial stage. The second stage without the loss of the Asmruti and the Meda in them. Here he told the second stage, Mohur Smrutir, Mohur Moha. The person will have the acts like and even the foolishness and even Sajjati Wang Mohu and Yuktya Ayuktya Pralapascha Prachala en Mevacha. Next he told Sthananyapana Sankat Yojana Savipareha Linga Netani Janiya. The person will have the stage of the incoordinated the movements of the body. And next third stage, the Tritiya Mada, in terms of it was Na Kinchin Ashubam Kuryanara Rajas Tamasaha. Because of the Raja and Tama and more of the Madhya, the person doesn't respond to any of these things. And lastly, he concludes that is Bhagna Darvyava Nishkriyaha. The person looks like the fallen, the wooden log. Like that, there will be the appearance of the individual. This is almost in a stage of the alcohol intoxicated, the coma, which is seen. Next, there are different the Veda, the types which is explained in the Ayurveda regarding the Madatyaya, Vataja, Pittaja, Kafaja, and Sannipataja. Panatyaya, this is from Charaka, this is from purely the Ashtangruta and the Shushruta. Panatyaya, Paramada, Panajirna, and the Pana Vibrama. If you go with the before starting the treatment, already you do the assess the patient and examine for the different dosha. The next part of the chikitsa, the only the samprapti vigatana. Okay, all of you know this. The Madatyaya is considered to be a Tridoshaja Vadi, the kapha dominant presentation which are most commonly as seen. Try to analyze the the dosha. Then easily we can go with the treatment protocol. That's why Saraka has told, Sarvam Madatyayam Vidyat Tridosha Madikam Tuyam Dosha Madatyaya Pashyat Tasya Adau Pratikarayet. In case of the Madatyaya, there will be the involvement of the Tridosha Dosha Dusti. Dosham Madate Pashit. Not only this, the Tridosha is the dominant involvement is the dominant presentation. Try to analyze each and every component in terms of in case of Vata, the person will have the Pralapa, Moha. In Pitta, the person will have the Daha, Trishna, Jara, like that. And Kapha, Aruchi, Trullasa. Try to analyze each and every component of the dosha. Then try to go with a different the treatment based on the particular dosha dusti. Here it told kapasthana anupruvam kriya kare madatya pitta maruta paryantaha prayena hi madatya. If the doshas are present in the kapasthana or the kapasthana involved or presentation pertaining to the kapadusti, then first try go with the kapasthana chikitsa, then we can treat other two doshas in terms of the pitta as well as the maruta. Okay, whatever the chikitsa which is explained, this is a generalized the treatment protocol which is explained. According to the disease specific, we have again the treatment protocol. If Vata Dushti is there, can go with the Abhyanga and Vatana Lomana. If person is having the Pitta Dushti, you can go with the Shita Ahara Vihara and the Virechana. If Kapha Dushti is told, is there, person told about the Charaka told about the Ullekana, that is in terms of the Vamana and the Upvasa. Generalize the other treatment for protocols in terms of the याभिः क्रियाभिः सिद्धा शमं यान्ति मदात्यः न च मध्यविधिं मुक्त्वा क्षीरमस्य प्रयोजयेत्. In terms of whatever the treatment modalities which are specific to the dosha, sometimes it is very difficult to plan, particularly in the person who comes in the state of the intoxication stage, or the person will have the binge drink. That time the shodhana is very difficult. Just we can manage those patients in a shamam, that is the shamana line of treatment. And even the kshira prayoga also abundantly Charaka has highlighted about the usage about the kshira in case of the Madatya, because it is having the Ojo Samana Guna and the best Rasayana and the Tridosha Shamana action. This is more specific to the kapha involvement, the disease specific and the dosha specific. You can go with the Langana Pachana Aushadaiha Shamana Irapi. If patient is fit for Shodhana, then only we can go with the Shamana modalities. If patient is not having the Pravara Bala just or in a state of the particular the Pana Vibrama or the Ajirna Lakshana, we can only manage those patients with the Shamana medications. Okay, these are the few of the chikitsas which are explained in the classics in terms of the first, all of you know, the Nidana Parivarjana is the first and the foremost protocol in any of the disease. That's why the Nidana Parivarjana Miyava Chikitsa is the first. Try to quit or just taper the dose of the alcohol in a Padamshika, the Upakrama, or just go with the Shodhana, particular dosha dusti. A patient is having the kapha or involvement of the kapasthana and the kapha dusti lakshanas, better to go with the sadhya vamana just by using the lavanambu. And even we can plan with the nitya virechana in a cases who are having the acute stage, and in a chronic cases where there is a hani of the smriti and meda, or even the manova shrotas presentation, we can go with the nasya with which are prescribed with the Medya Aushadis. We can go with the Brahmi Kruta or even the Himasagara Taila Nasya for the purpose of Nasya. Next, the most commonly followed treatment in our hospital will be the Shiro Pichu with the Brahmi Kruta, and just for the relaxation purpose can go with because most of the individuals even presents with the presentations of the Chittodvega and the Moha and Smritihani. Just to relax about that, go with Abhyanga and the Utsadhana. Among the Shamana medications, list of the Shamana medications, we have the Karjuradimanta, Shrikandasava, Ashwagandharishta, Draksharishta, Mrudvikasava, and the Saraswatarishta. But in my practice, I am restricted to the Shrikandasava, Saraswatarishta, and these are some of the patent medicines like the Mentat, Breobal, and Alert. A patient is having the Pitta dominant presentation, particularly Daha, Murcha, and the Pralapa. That time, better to go with the Pitta Dushti Lakshanas, the Shrikandasava. This is the reference from the Bhaishajya Ratnavali. There he told the Shrikanda refers to here the Chandana. All of you know that the Chandana is considered to be a best drug which is having the Shita effect and even the Daha Prashamana action. 10 to 15 ml of Shrikandasava twice or thrice a day after food it is given. Next, the Saraswata Arishta. Most of the individuals who are having the history of the Nidra Nasha or sometimes the Kampa, better to go with the Saraswatarishta. If you go with the Saraswatarishta from the Abhaishajya Ratnavali, it is explained in the Rasayana Rogadikara. It will mainly do the Chitta Santosha. It creates the aversion towards the consumption of the Madhya and corrects the Chitta in individuals. And few of the patent medicine, the combination of again the different, they made the Rasayana which is used in our hospital. These are the drugs, the Breobal, the Medhyavati, Alert, the Mentat. The next Adravya Bhuta Chikitsa. Sometimes you need even the Adravya Bhuta Chikitsa also in a patient who suffers with the Madatyaya, particularly the Harshana. The Harshana Kriya has to be given and Vanani Ramaniyani. Okay, now we can take the patient to the different places where it is having the Vana and the Ramaniya to look. And next it told Ghoshtaha Hridaya Priyaha. And the person who is well versed in the field of the Madatyaya Chikitsa and they are giving the pleasing words to the individuals just by consolation, just take them to those specialists. That is also explained. Next, the Dvida Chikitsa is also we can apply. This is all the Chikitsa Upakramas which are basically explained in the text. The Ekamulika Pravega, okay, most commonly we can use the single drugs like the preparation of the Abrahmi, Manduka Parni, Ashwagandha, Jatamamsi, where the involvement of the person who had the history of the Nidra Nasha, Kampa, Smruti Hani, and even we can go where there is involvement of the Akrut and even the Balahani. There we go with the Brungaraja, Kushmanda preparation, Kuducha and the Bhumyamalaki. But in my practice, I am restricted to the usage of the Bhumyamalaki, Jatamamsi, and the Brahmi preparations. Here we had few of the clinical experience what I had from last the 5.5 years in my clinical experience, which are purely treated in the form of the Madatyaya Chikitsa. This is a very interesting case I treated in our hospital. A middle-aged male patient, known case of diabetes mellitus and alcoholism from past 7 years. He was apparently normal 1.5 years back. Gradually, he started developing the yellowish discoloration of the sclera, distension of the abdomen, which is associated with reduced appetite and bilateral pedal edema. Okay, try to analyze the Ayurvedic, the understanding about the each and component like the sclera, the yellowish discoloration. The patient had almost the presentations of the Kamala. Next, for that, he consulted the gastroenterologist in Hubli. They diagnosed this case by different the investigations. They put it as a query, parenchymal liver disorder, and given the medication for 1.5 years. And finally, they went to that patient, that doctor again. He told to transplant their liver. Just try their situation. They wanted to do their liver transplant. Finally, by the advice of her, their relative, patient come to our hospital and just treated that patient with the Kamala and the Jalodhara line of treatment. Patient got 100% result in a span of 3 months. Just we look the few of the reports of that patient. Initially, a patient consulted a doctor in nearby hospital. Just see the report, the impression of the UHA abdomen. Hepatomegaly with coarse echo texture, that is chronic liver disorder, collapsed portal veins with periportal collaterals, that is chronic thrombus, splenomegaly, moderate ascites, multiple pancreatic collateral noted, and gallbladder which is thickened and edematous. This is the earlier report which is taken in 2019, 25th November. Okay, after that when he came to the our hospital, the USG is repeated before starting the treatment. The patient again the relative enlargement of the caudate lobe of the liver with showing the coarse echostructure and irregular margins suggestive of diffuse parenchymal disease with mild ascites and hepatomegaly. I think he is not having the mild ascites. If you can see the image, definitely you come to know what is the extent of the edema in him. And the blood reports the earlier before the treatment it was 2.1. Just see this image. The later after the treatment it is in decreased again in between the patient on irregular medications. The condition got worsened and it was again came to the little bit the patya following and irregularity of the medicines. It is reduced to the 3.2. At present report I don't have with me, but patient is all right. Symptomatically he is nil and he is continuing with some of the medications. If you see this image, okay, this is the case which is treated in last one from 1 year. Okay, the before, this is the image. See the edema in both legs after the 10 days of the medications. Almost the shota or the edema which is reduced in this case. The USG report has given the mild ascites, but it is not so. This patient had around 1 meter. The abdominal girth was, you see here, 1 meter. It is before the treatment. After 10 days of treatment, it is reduced to almost the 84. Where you see the 84. That was the outcome with just Ayurvedic the medications. The first course when he got admitted to our hospital, just treatment planned on the IPD basis, tablet Arogya Vardhini Rasa 2 BD before food, tab Nirosil 1 tablet thrice a day after food, cap alert 1 tablet after the food, and early morning empty stomach. The Gomutra Arka is given with 3 tablets of the Triphala just to remove the Kledata and the Shota in individuals. If you see the Palashruti of the Arogya Vardhini Rasa, it is having very good result. It is having the Tamra Basma, Loha Basma, and the main, rather than that, main ingredient will be the Katuki. Most of the patient who presents with the Kamala and even the Akrutodara, they need the Karshana and even the Shotahara line of treatment and the Nitya Rechana property. That's why these drugs are the selected, and Nirosil, it is the single drug, the Bhumya molecule which is present in this drug, and alert, it is mainly to correct the Nidra Nasha in the individuals. This was the treatment which is prescribed in first 10 days. The second course again continued with these two drugs, the Nirosil and the Arogyavardhini Rasa, and just changed with the Avipattikara Churna during the morning hours, 2 teaspoon, during night hours, 1 teaspoon with hot water for 20 days. The third course, after a completion of the 1 month, again we changed some of the medications. Third course, the patient had again given with the Arogya Vardhini Rasa 2 BD before food, and tablet Nirosil 1 tablet thrice a day after food, and Kumar Rasava. Just change with the Kumar Rasava. The Kumar is the one which is having very good result in the involved where there is involvement the Yakrut. And again for the Nitya Virechana action, the half teaspoon of the Avipatikara Churna which is given during the night hours. So what is the rationality behind these? The prescription in case of the patient who suffers with the history of the Madatyaya, either they will end up in the presentations of the Kamala or Kamala with Shota and the Akrutodara. Try to combine the treatment of these, the Kamala, the Shota and the Akrutodara. All of you know that the general treatment protocol for the Udara, Shroto Marga Nirodhanat Sambhavat Udaram Tasmat Nityameva Virechayet. For the purpose of the Virechana and Vatanulomana action, better to go with the prescription which is having the Anulomana drugs. Avipatikara is one such drug which causes the Virechana in individuals. Other case, the second case again we treated Okay, one thing I forgot to mention here, this patient initially had the history of the diabetes mellitus and he was on the glycipage G1. But after giving these many treatments, presently this patient, I think after 1 month, initially we continued with the glycipage G1 for his the diabetes condition. From last 1 year, he is not at all taking the drug for the diabetes mellitus. Okay, that is also relieved by our medications and almost he is having the HbA1c and RBS, PPBS, everything goes within normal limit and he is asymptomatic at present, only continuing for him with the Arogyavardhini Rasa 1BD and Nirosil 1BD, just Kumarasa for 10 ml OD. And whenever he is having the Vibanda, then only I told him to continue with half teaspoon of hot water. Okay, next month again we thought of the repeating all the reports for the documentation purpose. This case second, this is also very interesting case. A middle-aged male patient, not a known case of diabetes mellitus and hypertension was apparently normal 7 years back. He had a history of their consumption alcohol on the daily basis. He started developing the sleep, reduced sleep, tremors in both the hand, associated with the visual hallucination and anger outburst, almost the pitta as well as the vata dushti presentations. He was initially visited many of the hospitals, later came to our hospital and he got admitted in our hospital, just given the shiro pitch with the brahmi gruta and here just changed because he had a severe the tremors and even the insomnia and irritability is very severe in him, just given with the Medyavati, the combination of the Manduka Parni, the Shanka Pushpi, it is prepared by the STM pharmacy, one tablet twice a day after food, and even the cap alert. The main ingredient in this is the Jyotishmati Taila for the correction of the Smriti in and the Nirosil just to correct the hepatic changes in a individual. This patient, because he had a severe Pitta Dusti, given with the Shirikandasava 10 ml thrice a day after food for 7 days. After 7 days, the same medicines because patient relieved with almost the symptomatology and given with the same medicine for another 20 days. Patient was all right. The third patient, the one more, the middle-aged patient, again, not a known case of diabetes mellitus and hypertension, was apparently normal 3 years back, gradually started developing the reduced appetite, yellowish discoloration of the sclera, pain in the right hypochondric region, and reduced sleep and tremors. Almost Tridosha Dosha Dusti, which is seen in this case. This case earlier also visited many of the hospitals and later came to our hospital, just given the Arogyavardhini Rasa 2BD, 2 TID before food, Cap Bravobal 1 TID, 1 BD after food, and Shrikandasava 15 ml twice a day after food, and Avipatikara Churna 1 teaspoon twice a day after food with hot water. After 15 days, again the patient done with the Apollo. The few of the medications, the dose is reduced and he is asymptomatic at present. And whenever we want to shine in the field of the Ayurveda, we should know about here and there and the research or evidence-based medicine. Everyone, whenever you show the improvements before and after treatment, then only the people will agree with you. For that, we have the different researchers which are documented in the Ayurveda. We have the separate the research portal in the name of the ICE research portal. Just Google it in terms of the Ayurvedic terminology, select the Ayurveda and put the word Madatyaya. There are different studies which are available, the post-graduation thesis as well as the PhD thesis which are documented regarding the Madatyaya. The few of the studies here, a comparative clinical study in the management of Madatyaya and different the studies like the usage of the Ashtanga, Lavana, Vamana and Ashtanga Lavana in a comparative study. Okay, there are those, not only these, there are many other. Okay, whenever you want to shine, always try to do the evidence-based medicine and try to have the evidences with you before and the after treatment. Then only people will respect you and you can shine like anything. Before the conclusion, in the Madatyaya Chikitsa itself, Charaka has explained the Annapana वयोव्याधि बलकाल त्रिकाणि षट् त्रिदोषं त्रिविधं सत्वं ज्ञात्वा मध्यम पिबेत sada. If you want to use the madhya for the therapeutic purpose, just consider or whenever you want to use the madhya, you should have the proper anna, pana, and the vaya of the individuals, vyadi, particular disease condition. You need to select the particular the madhya and the bala, vyadi bala, and even the rogi bala, and the kala of the administration of that particular madhya. And not only these, based on tridosham, according to the tridosha, vata, pitta, and kapha, you need to select the madhya. Earlier only discussed about that. If vata is dominant, better to go with the madhya which is prepared out with the guda. If pitta is dominant, the mrudvika sadhita. Kapha is dominant, the madhu or madhvika sadhita. Like that, sattvam nyatva. And you need to analyze the trivida sattva, like rajasika, tamasika, the sattvas. Based on that also, one should go with the prescription of the madhya. Otherwise, it's very difficult to manage the individuals. At last, even told about pranaha pranamrutamannam yad yuktya yuktya nihantasun visham pranaharam tacha yuktya yuktya rasayanam. If the anna, okay, how anna is prana to the individuals, if it is taken in a proper manner, or whatever the ahara vidhi visheshayatana which is followed, if it is not followed, then we can land up in the different disorder, or even it acts as the visha. Like that, if the all of you know the visha is considered the fatal to the alive, if visha itself is taken in the form of the yukti, considering the different factors and the disease condition and the proper the methodology for the administration, that madhya itself or the visha itself acts as the rasayana. Okay, at last, to conclude, try to avoid the madhya. Combined approach of yukti vyapashra and sattvavajaya chikitsa is very essential in the treatment of the Madatyaya. Follow the sadruta and achara rasayana for healthy and happy life. With this, I end my presentation. Thank you one and all for your patience hearing. If you have any queries, always welcome.
Thank you, sir, for your presentation and sharing your knowledge. Sir, some questions are arised by audience. Can I discuss them?
Yes, madam. Can I end the screenshot?
Yes, sir.
Okay, madam.
Whether Madatyaya is Vyadi or Avastha, sir?
Yeah, you need to consider the Madatyaya. Okay, I told earlier, based on the Avastha, okay, Pratama Mada, Dvitiya and Tritiya Mada. If it is not there, then disease itself, we can consider disease itself and we can follow the treatment protocol of the Madatyaya itself.
Thank you, sir. Next question. It is possible to plan treatment as per Avastha?
Yes, we can definitely plan the Avasthanasara Chikitsa. For example, the person who is having the acute stage or the madhya, in particularly in terms of the panatya, panamada, panajirna. Based on that also and based on the analysis of the dosha itself, we can go with that. The most commonly in case of the the intoxication, better to go with the karjuradi manta, that itself acts as the sarva madhya vikaranut, and it is having the property of the balya and brahmana and sadhyotarpana.
Thank you, sir. Next question. Whether alcoholism is genetically inherited?
Some of the studies were conducted regarding this. There is an influence of that genetic inheritance is also possible if mother and father are having the history of the alcohol consumption. That also even affects the progeny also.
Next question. How Kumara Asava acts on Madatyaya?
Usually, if you go with that prescription of the Kumar Asava, I already told the involvement of the Akrut. It will do the Akrut Shodhana properties, and even the person who is having the Daruchi, Agni Mandya, it will always correct the Agni Mandya. If you go with the Palashruti of the Kumar Asava, the person who presents with the Madatyaya, most of the time they will have the Aruchi, Agni Mandya, and even the lack of the consumption and aversion also. Better to correct about that. The Kumar Asava is very useful.
Thank you, sir. Last question. Any experienced drug like Surari and Dhumari?
Yes, it's available from some of the the companies which are preparing that, again, it is nothing but the aversion therapy. I think one of the pharmaceutical industry is preparing the surari for the purpose of the madhya de-addiction purpose. Okay. Madatyaya individuals, they are using the surari. Again, the combination of the medhya aushadis that is available from few of the Rajasthan pharmaceutical industries. I am not using that in my practice. I am using only the classical preparation about the Madatyaya chikitsa. Okay, whatever we discussed in terms of the Vipatikara Churna, Saraswatarishta, Alert, and even the Bravabol, such drugs, the combination of the Medhya Rasayana and drugs which are acting on the Akrut and the Ashota, that always I combine and treat the cases of the Madatyaya.
Thank you, sir. Another question. In which disease we can use madhya as aushadha?
Yes, definitely we can use madhya as the aushadha in many of the clinical condition. If you go with the reference pertaining to the madhya varga in the sutrasthana, Charaka first started with the word that is krushanam sakta motra purushanam grahane arshogadam. The person who is having the krushata for the purpose of the brahmana again, and even the disorders like person where the vibandha of the amotra purusha and even involvement of the Anna Shrotas. Not only these, just an example like this, even we can use in the Swasa Kasa, many more disorders just by the proper, the Matra, and even the select the Madhya, which is having the property which is do the specific dosha shamana. For example, Vata Shamana action in Sutrasthana, we have the Sura as the best. For Pitta Shamana action, the preparations like the Mrudvika Sadhita Madhya, like the just we can use the Mrudvika Kashaya. So based on that, we need to select the particular, the Madhya which is having the property of particular dosha shamana action. Definitely we can give the Madhya as the Aushadha in many of the disorders.
So last question, sir. Why madhya is given in Madatyaya?
Yes, there are different the things which are explained in the again. Whenever you plan the madhya in the required the quantity, the matra, vaya, bala, everything is considered. There he told initially the madhya is the one which is having the amla guna, amla udrikta, the amla guna that will do the whenever it enters to the annava shrotas, there will be the again the vidahata which is included, or in the vidaha which is vidahata of the anna rasa. By that again the ksharat, people supplement the madhya in those individuals who are already having the vidagdha ahara, the ksharata which is by supplementation of the again madhya in them, there is an increase of the ksharata in the body, and because of this the madhurata, whenever you go with the avastapaka, the achievement of the madhura avastapaka, the person will get rid of the madhya. It's purely based on the again the selective drug again which is having such properties. Such madhyas has to be administered, not the haphazardly we can't use the single the madhya preparation in all the dosha dushti. That's why Charaka is very peculiar about the selection of the madhya as the medicine, and considering the different factors. I already told the set factors like anna, pana, vayo, bala, and even the satmeta factor also very important here. Considering that we can use madhya as the aushadha in case of Madatyaya itself. And finally, I told if madhya is used in a proper manner, considering the yukti of the physician, that itself acts as the rasayana and amrita.
Thank you, sir, for the discussion. Now I request Dr. Shiddanagouda, sir, Professor, Department of KAYACHIKITSA, for vote of thanks. Over to you, sir.
Thank you. Is I audible?
Yes, sir, you are audible.
Okay. Good afternoon, everyone. Myself, Dr. Shiddanagouda, Professor, Department of KAYACHIKITSA, SVM Ayurveda Medical College, ILKAL. So today it was the second day of our national webinar, national level webinar series, KAYACHINTANA, fourth series. So Dr. Shiddanagouda KB, Associate Professor, Department of KAYACHIKITSA, Sindagi Shantavireshwar Ayurveda Medical College, Haveri, has been presented a webinar series on clinical approach of Madatyaya. Sir, your webinar was very informative and interesting. So, and it is one most wonderful one. So we are very much thankful to you. On behalf of our chairman, vice chairman, secretary, all the management committee, respected principal sir, and all the teaching and non-teaching staff, PG scholars, internees, UG students, we are very much thankful to you for your wonderful session, sir. Thank you, sir. At the same time, I extend my gratitude to our management committee, including chairman, vice chairman, secretary, and principal sir also, and teaching and non-teaching staff for their kind cooperation and support toward this webinar series, which will make the webinar series successful. At the same time, I would like to take an opportunity to say my sincere thanks to all the teaching and non-teaching staff, all the PG departments, all the interns who participated in this webinar series. My heartful thanks to all those. So thank you one and all. Thank you, sir, once again.
Once again, I thank all the organizers and all the participants and all the person who is behind this successful organization of this webinar series. Thank you one and all.
Thank you, sir. Thank you everyone for the participation. Now we will end the session.